All right, so I'm on my way home right now. I just got out of the surgical facility. I can't say enough about all the staff, the doctors there. It was a really quick and easy, really good experience. Everybody was super accommodating and nice. It was very efficient. I went in and had several pre-checks. They made sure that it was the correct shoulder, who I was. They took me back once they got the IV into the operating room. They told me to lay down on the table, and within probably 10 to 15 seconds, I was out like a light. So I woke up about an hour later or so. It took about an hour and 15 minutes for the pre-op stuff, and then I was in surgery for about an hour. I woke up in the recovery room super groggy, super tired, but that's probably partially because I haven't slept very well recently due to the little minor illness that I've had. But I woke up, and then the nurse started giving my wife instructions, started giving me instructions. I don't remember most of it right now, but we've got it down. The doctor also was super accommodating and allowed my wife to actually video him, because I had several questions that I had before on what specifically the repairs were. I was super thirsty before the procedure and super thirsty after. I drank probably about 4 or 5 20-ounce bottles of water, and now I'm on my way home, and I'm pretty hungry, looking forward to eat. I can't feel my right arm at all due to the nerve block. So I could initially, after surgery, move my fingers. They asked me to move all of my fingers, and now I can't move my fingers. So I'll be manually manipulating with my left arm, and just making sure that they, move around and get good blood flow. But I'll give you an update on the specifics for the surgery after a bit here. But it all went really well. Really super pleased, and I actually feel pretty good right now. Pretty surprised. A little bit groggy, but I feel pretty good. So give you a little bit more of an update soon. All right, so I'm home. It is approximately 2 o'clock in the afternoon now. I've been home for probably a couple of hours, and things are actually going incredibly well. Like, I can't even describe what I thought was going to happen versus what is happening right now. I think that's mostly due to the nerve block that I've got going on. I actually cannot literally move my hand at all. And we've talked to the surgical unit, and they've said, hey, that's totally normal. Don't worry about it. So we're good to go. So I'm just going to make sure that I move and flex my knuckles and my joints a little bit in that hand every once in a while, just to make sure that everything is working well. But no, so far so good. So I've set up a bedroom so that I've got a bed here. I probably won't be using that. I got this recliner here with one of those soft little blankets on it. Those are the surgical pillows that I had. They were just going to throw them away, so we brought them home. An ice pack right there, and then I've got a little stand right here that I've just realized doesn't do me very much good because of where it's located. And in the back here, we've basically got a bunch of pillows and space that we're going to put that ice machine. So, long story short, and then there's going to be my entertainment for a while. Right now, I'm really surprised that I'm actually up, and I've been wanting to walk around and move. I actually feel pretty good with no pain in that shoulder because of this block, this nerve block. I'm feeling pretty good about things. So the doctor gave a pretty good indication on exactly what happened when he got in there. So I'll show you a few of those pictures. So if you can see these, I'm not sure, but so this first one right here is the glenoid joint, and so he said that that looked amazing. He was actually super surprised that with all the heavier lifting that I'm doing, that that was not in bad shape. He said that's a perfect sign of health right there. He was like really happy to see that glenoid joint soft and smooth and in really good shape. So that was good news. My biceps tendon on the other hand was in pretty bad shape. So he said that, yeah, he definitely needed to repair that bicep tendon. And so instead of being attached to the scapula, now it is attached to my, my humeral head. And then here's another picture of, of that, not in the best of shape. So um, my labrum was actually in really good shape. He was surprised. He said, no, the labrum was in good shape. So there's the labrum. And then the biggest issue that I had was the supraspinatus tendon. That's supposed to be just big white piece of meat over the top of the bone. You can see there, it's kind of yellow, the greater tuberosity. And with that bone right there, basically it's completely, you can see all the way through it. There's a big huge rip and tear right in the middle of that supraspinatus, so that was pretty large. And what he did is he repaired it, so he had to use one anchor. It's a type of anchor that's plastic, that goes into the greater tuberosity. And then you can see these laces. They're like big, huge, thick shoelaces. Those are the sutures that tie it all up. And then eventually it brings it into this kind of a situation right here. So I don't think I actually showed you the right picture. So it took it from here, those are the shoelaces, sorry, to this particular picture right here. So this is the repair. That's the way that it should cover the greater tuberosity. Everything should be okay. So yeah, so he was actually happy because my subscapularis was in good shape. My infraspinatus was in good shape, but the MRI showed that they weren't. So it just kind of shows you, that surgeons usually know more what they're talking about than the radiologists. So nothing against the radiologist, nothing against the surgeon. Just in this particular case, in my case, the radiologist showed some different things, and the surgeon said, no, I think it's this way, and the surgeon was right. So the good news for me is that the repair was not nearly as extensive as that we thought that it might have to be. Only one of my rotator cuff tendons had to be repaired. It was a pretty significant repair, but he said it was actually a pretty easy repair as well. So he has a lot of good faith that that's gonna work out pretty well. And as far as the glenoid joint, it's in really good shape. He was really happy with that. And I did forget to tell you one thing here. This picture, if I can show you, right there, you can see all the bone spurring. That's the arthropathy that I had. So he smoothed all that out, debrided it, got rid of those bone spurs. So that was the other thing that he did as well. So basically three things that he made some major changes on. And right now I've been walking around the house. I've been wanting to walk around the house, and hopefully I'll be able to do that. Maybe in an hour I won't be feeling that way, or maybe tomorrow, I'm not sure. But while I can, I'm doing it. I was super hungry after surgery. I ate a lot of food. Feeling good about that. Drink a lot of water. Just kind of rest and relax. And so I'm actually feeling better today after surgery than I felt on Monday when I got that little bug. So I'm pretty happy about the results so far. And I'm just going to keep the faith, and hopefully things will continue to go well.